So far, I've never heard anything bad about him. I only hear good about him. It's pretty. Is there anything bad about him, Bobby? I don't know. I haven't heard anything bad. Someday, maybe it'll come out, which will notify you immediately. But so far, I haven't heard that, including the drugs known as Zepbound and Wegovy, often called Ozempic. This is a triumph for American patients that will save lives and improve the health of millions and millions of Americans. Amazing thing. They are amazing. I want to thank Eli Lilly CEO David Ricks, a friend of mine. We've worked long and hard. He and I got this whole thing started in a way. And Novo, Nordisk CEO Mike Dustar for joining us today. Great, talented people. They make a lot of money. I looked at the money, but they're entitled to the money because the companies are doing very well. Along with Secretary Robert F. Kennedy Jr., Secretary Howard Lutnick. Do you take any of this stuff, Howard?
Not yet.
Okay, good. CMS Administrator Mehmet Oz, he doesn't take it. Food and Drug Administrator Commissioner Marty McCary, and Director of Medicare Chris Klump. And we have Steve. Where's Steve? Is he here? Head of Public Relations for the White House. He's taking it. The United States is just 4% of the world's population and consumes only 13% of all prescription drugs, yet pharmaceutical companies make 75% of their profits from the American customer. I would say that's not so good, right? It's not exactly great. To address this chronic unfairness, I signed an executive order earlier this year instructing my administration to do everything in our power to implement most favored nations drug pricing, something that has been helped greatly by tariffs, because when nations refuse to do it, we should have put this in the case yesterday. I just say, well, if you're not going to do it, we're going to charge you a like amount of tariffs. And they immediately say, we'll do it, which means that Americans should pay no more than the lowest price offered anywhere in the world. So that you've heard for years the disparity where you'll pay $150 for a pill in New York and you'll pay $10 for a pill in London. Now you're going to pay $20 both, because the world is a little bit bigger than the U.S., so it goes up that way, but you'll pay $20 and $20. A tremendous advantage to our country after years of being abused by the world system. Already Pfizer, AstraZeneca, and EMD, Serrano, have agreed to drastically lower their prices for American patients, and today Eli Lilly and Novo Nordisk are joining the phenomenal list of the most exciting announcements. I mean, nobody's ever had announcements like, and this has to do with other pharmaceutical products also. But we're covering this today because it's such a big seller. I guess it's the #1 selling thing there is today. These are two companies that behind the groundbreaking weight loss drugs that have helped millions of Americans struggling with obesity live better, longer lives, everything else. These are the two companies that really broke ground. Until now, neither of these two popular drugs have been covered by Medicare for weight loss, and they've only rarely been covered by Medicaid. They've often cost consumers more than $1,000 per month, and some a lot more than that. Americans have been spending as much as 520% more for Zepbound and 1,400% more for Wegovy than patients in Europe. Think of that. 1,400% more than a patient in Europe for the exact same box. And that ends starting today. The other countries are not happy with us. I don't think they like me too much, Bobby, but that's okay. Eli Lilly and Novo Nordisk are committing to offer Zepbound and Wegovy at most favored nations rates for American patients. This will slash the cost of Wegovy from $1,350 a month to ultimately $250 a month. $1,350 to $250. Did I do a good job? They don't write about it. You know, they like to not write these things. And reduce, you think Biden could have done this? I don't think so. And reduce the monthly cost of Zepbound from $1,080 to $346. In addition, they're both committing that future GLP-1 weight loss drugs taken orally, which are currently under development, will be sold at no more than $149 per month. It's a massive, think of that. You go from $1,300 to $149 a month. We anticipate these new versions will be coming out in a very short period of time. All of these drugs will be available directly to the consumer at trumprx.gov. Trump, they want to use my name. Trump, it better be good. trumprx.gov. And I think it's turning out to be pretty amazing, right, Oz? Just as significantly, Medicare and Medicaid will finally cover the cost of these weight loss drugs for millions of patients suffering from obesity. Co-pays for Medicare patients will be as low as $50. This is tremendous savings. I mean, now you're talking about from $1,350 to $50. This is tremendous news for the American seniors. And you all remember when I had 1/8 of 1% for the year. I cut it 1/8, and I was so thrilled. But now we're cutting it 1,000%, 1,200%. Nobody's ever seen anything like this. Nobody else could have done it, but I say that modestly. In addition, you think it was easy dealing with these people? It wasn't. You think it was easy saying, your drug, Mr. Eli Lilly, that we're selling for $1,300 is going to be sold for $250. You know the amazing thing, the stocks all went up. I mean, these guys they're fantastic.